My name is Mohamed El-Ashry. I'm a consultant ophthalmologist, cataract surgeon. Also, I'm a vitreoretinal surgeon. I work at Great Western Hospital, and for my NHS job, I'm also working privately in Shelbourne, in Ridgeway, and Litchfield in Bristol, and other places. The cataract surgery is safe or straightforward in 95% of cases. In 5%, like any surgery in life, you may have some, like adverse effects or complications. However, the majority of the cataract is straightforward. If there is any risk factors of the cataract, we normally speak with the patients, explain the risk factor, also explain the prognosis for the vision. We also discuss with the patients the options and the potential for the different types of the intraocular lens that we use in order to achieve the best possible outcome from our surgery. If the patients had previous surgery, for example, retinal surgery, or had any other ocular comorbidity like glaucoma or other corneal opacity like the cloudiness of the wind of the eye, or have difficulty like in have a small pupil, or maybe have highly advanced cataracts or cataract that doesn't have lens that doesn't have enough support. This is all can impact on the the surgery, and also adding to the risk factors of complication. However, as a retinal surgeon myself, I deal with the complicated cataract. I deal with the difficult and complex cataract, and if I got like referral almost continuously for any difficult cataract that may be referred from any of my colleagues, because for a complex or complicated cataract, it is preferable to be performed by a retinal surgeon. So if any, difficulty happened during surgery, or for example, the lens, couldn't be removed from the usual pathway, as a retinal surgeon, I'm able to remove the lens and also put an intraocular lens that can fulfill the requirement of a good vision for the patient. The most common complication that can happen in cataract surgery is what you call rupture of the posterior capsule, which is, when we remove the cataract, we leave the bag of the lens, which is as a support for the intraocular lens implant. Sometimes during the surgery, this tear or break in the bag sometimes happen. And this is happen in a percentage, very, very low percentage. It's not a high percentage to happen, especially with the experienced surgeon. So even if it's happened, we just operate, like extra step, which we call anterior vitrectomy, in order to clear this gel, and then just, make it suitable to implant intraocular lens. Other, complications that can happen during surgery, raise the pressure, of the eye. Again, this is we can deal with that with any intraocular drops, and also maybe some inflammations. Again, those complications are not common, but even if it is happening, we are capable to deal with those and just make sure that the patients get through those difficulty and achieve good visual outcome at the end. Well, when the patients come for cataract, we do full examination of the patient. We take a full history from the patients. Also, we do some tests like optical coherence tomography and autorefraction, sometimes corneal tomography, and all those tests, ensure, that we cover the whole range of the eye. If there is any other ocular comorbidity that may add to the, the difficulty or add risk factor to the cataract, we have a full assessment and full evaluation of those factors. And then we give the patients a clear idea of, the whole, process involving the surgery, involving the outcome, involving the potential for vision. Also, if there is any difficulty or any comorbidity or risk factor, also discuss with the patient. If the patients, after evaluations with the test and the examination, have any risk factors, we are capable to deal with that. For example, if the patient had a small pupil that cannot be, like dilated, we use some factors to dilate the pupil, put some, like extra gadget inside the surgery to dilate the pupil. I'm capable as well to operate through a very small pupil, safely and with a straightforward surgery. If the patient have any other factors like inflammation or glaucoma, we modulate the treatment either before or after surgery in order to ensure that also that he achieve the potential and the aimed visual outcome.